So Eugene, can you just outline some of the key points of today's announcement?
I think the big message from the announcement by the Chief Medical Officer today is that there is no absolutely safe level of alcohol. The guidelines that are issued are indicative. They're for people to make up their own minds about what they're doing. But we know that consuming alcohol is associated with various different health risks. We know that it's associated with some cancers. The evidence is strongest that it has an association with breast cancer. And any amount of alcohol, I'm afraid, does increase your risk a bit. The real choice that people have to make is what kind of risk they're prepared to live with. In the same way as you choose to drive a car and you know that has some risk associated with it, you choose to do different things in your life. With alcohol, you have to think in the same sort of way. And if you want to drink, then try and keep it to a safe level. Now, what we consider to be a safe level under the new guidance is a bit lower than we would have recommended in the past. What we're saying is that you shouldn't drink more than around about the equivalent of a pint of beer a day or a glass of wine a day, and that it's sensible not to do that, take that amount all in that you might take a week all in one go, but to have days when you don't drink any alcohol. And the guidance for women who are pregnant or who might become pregnant is that it's probably best not to drink any alcohol at all.
Okay. If someone thinks that they or someone they know may have an issue with drink, where can they get help? How can they get help?
Well, first of all, there is plenty of help available. And one of the things we know is that this is not something that's confined to any particular group of society. There are plenty of people that you know that you work with, your friends, members of your family who might at some point have a problem with alcohol. The way to get help is either to go to your GP and talk to them about it, and the GP should be able to help you with support if you need to try and do something about that. And there's also a service in the city that we commission through the council from Lifeline, and on the website with this video there should be a contact number if you want to get in touch with them.